Okay. So when they asked me to come and talk about this, I was really unsure of what I needed to do or touch bases on, which is why I'm going to just hit a few slides, and then I will discuss out there at the Krells the things that especially you want further knowledge on, okay? So I thought, what would apply to something like this? And I think zoonotic disease is something that we always have to bring up, and we'll discuss. I'm going to give you a couple of examples because I want to plant the seed in your brain that you ought to take care of some things. Livestock vaccines and pharmaceuticals, is there hazards associated with that? Absolutely. I don't know how many of you have ever injected yourself with blackleg vaccine, but there's a wide array of colors that you turn in the spot that you inject, and it hurts like crazy. That stuff really hurts. We're going to talk a little bit about chute side safety. We got into a discussion last night a little bit about it. I know of 2 people that ruptured spleens when we were working cows. And myself, I got sent to the hospital when my son was really little and he didn't know how to operate the radio telephone in my truck. He was trying to call for an ambulance working around the chute. So you got to be careful. But this is also part of it too. We've got to keep in mind, which BQA pretty well reinforced, but we need to keep in mind food safety because that is the business we are in. We are in the food supply business, and so what we do to keep our product healthy and safe and wholesome further down the chain are things we need to pay attention to. Okay? So I'm going to touch on, I wanted to pull out a couple of examples. Brucellosis, of course, is a historical one, but the reason brucellosis was a controllable or a programmed disease by USDA is because it's bad news. If you get brucellosis, or undulant fever is what it's called in people, there's not really a cure for it. They can control it, but it's bad news. Well, in the cattle side of things, there's a high rate of abortion. It's abortive disease. It's a late-term abortion. It's a big abortion. So why is that important? If they're big calves when they're being aborted, who cares? Well, sometimes they need assistance. And so when you're helping an abortion out in the country, you take precautions because a lot of the diseases that cause late-term abortions are zoonotic diseases in people. So it doesn't matter how cool you are or how macho you are, clean up and put gloves on and stuff. Wear sleeves because brucellosis is bad news. One of my classmates contracted it in Saudi Arabia. He worked on a dairy and he got Malta fever, which is a little different strain of brucellosis, and it settled in the joints of his hands and he had to leave practice because he got so crippled he couldn't practice anymore. So brucellosis results in weak full-term calves that die shortly, but this is the deal. Generally speaking, it's a late-term abortion that you may assist with. Okay? Lepto is the same thing. Lepto is caused by an organism, a spirochete, that has a lot of different serovars, and depending on the serovars dictates what happens with the disease, but it's generally speaking, it's a reproductive failure disease. It also affects the kidney and urinary tract. It has high affinity for urinary tract. So a lot of times cows that are suffering from lepto, it'll be in their urine. Now, it goes back to lepto, generally speaking, the form of lepto that we tend to see in New Mexico is a late-term abortion. It's another instance of where you may have a cow that's showing problems and you get in there and assist her. And you can contract this disease just getting a little bit of urine splashed in your eye. Or fluid that if you got cuts on your hands and you contract that spirochete into an open wound on your hand or an old cut or something, you can get this disease. And the problem with lepto is that it can kill you. It causes fairly severe kidney disease that can be fatal. And so you need to be aware of these things. This is something that you die from. So you need to be careful. And so how do you do that? You take proper precautions whenever you assist a cow, especially in abortion. I'll urge you to be really cautious and make sure you're clean. You clean the cow up and you take personal precautions. Wear sleeves. I usually put a sleeve on and put a latex glove over it, because when you're in there working around them there, especially with the calf, and you're fooling with their teeth and trying to get their head, whatever, you end up nicking stuff. Be cautious, okay? It's transmitted venereal. The disease itself in cattle is easily transmitted through the placenta, breaks the skin, mucous membranes. it is a reproductive disease, is the most common, but this has a wildlife component to it. There's a lot of rodents and wildlife that carry lepto, and they shed it in the urine. I had an abortion storm in some registered limousine cows where 22 out of 25 aborted over a 3-day period. When he pinned them in a trap, he had a little forest allotment, he pinned them in a trap. They still watered at the same dirt, water source that they always did, but there was some elk that were in on that little dirt tank. And then when they pinned those cows in the trap, those elk were hanging out there. We cultured lepto out of the water of that dirt tank, but 22 out of 25 cows aborted. And so there's other diseases that you have to pay attention to that we deal with in the livestock industry. Toxoplasmosis is something that it's a protozoan parasite, but it can cause brain problems. This is bad news. Q fever, we see this in New Mexico, especially in goats that are having reproductive failures. And so it is not unusual that they'll end up having a difficult delivery and retain membranes. And it's pretty common in goats. And what do? You go in there and you help them, right? And if you do that, Q fever is a concern from a health standpoint.
Is Q fever also highly contagious for females at childbearing age?
Yeah, I mean there's that particular bacteria. I think it's a bacteria. It's Coxiella. I think it's a bacteria. Anyway, yeah, can result in reproductive failure in people that can be permanent because of the resulting infection that can happen. Anthrax. Does anthrax happen in New Mexico? Yes, it does. We have a lot of anthrax in soil, especially in north central New Mexico. It is not unusual to have cattle die because of anthrax. And the problem with that is that one of the telltale signs is this could be an anthrax cow is there's blood at every orifice. Well, that happens with normal post-mortem change, But there's blood coming from the eyes, there's blood coming from the rectum, there'll be some bloody foam in their nose and bloody fluid in their mouth. If you see that, as veterinarians we're trained, don't cut them open, because the worst thing you can do with an anthrax cow is expose them to oxygen. Because if it is anthrax, they're spore formers, and they will aerosolize. And so you can expose yourself. Is it severe? There are different severities of anthrax out there in the world. And obviously, and the route of exposure and the virulence of that particular anthrax strain has a lot to do with how sick do you get. But it's not unusual for people in New Mexico to be exposed to anthrax from natural causes. So you got to be aware of that. So if you ever post a cow and you see her bleeding from every orifice, you may want to take a step back and maybe not. The way we do it is we'll cut a piece of ear, and there's a stain that you can use to stain a spot of blood from that piece of ear and tell you whether or not anthrax is present. There's characteristics that are very specific to anthrax under Giemsa stain. And that's what we do. So, is plague common? Absolutely. All the time. And it's a prairie dog deal, right? Prairie dogs have plague. The fleas that infest prairie dogs carry plague. And we always have cases of plague every summer, right? In New Mexico? It happens all the time. And so we have to be aware, especially if you ever see a die-off of a prairie dog town, a really high death loss, you might want to contact Department of Health and have them trap some fleas around there and look, because you need to know, did that prairie dog town die of anthrax? Because that's pretty serious, and you need to know that, especially if it's close enough that your pets may get in there and pick up some of those fleas. When those prairie dogs die, what are those fleas looking for? And they're looking for a new home, aren't they? And they'll jump on anything. So you got to be really cautious. If you see a die-off of prairie dogs, get it explored, because that plague is bad news. And then, of course, rabies. Our biggest exposure to rabies Used to be dogs, now it's cats. But in New Mexico, one of the things that we see a lot of is the gray fox rabies that's associated with that Arizona shared with us. And it's pretty severe form. We had, like in Silver City, we had foxes chasing people in the middle of town during the day. I had them chase my pickup and be running alongside me trying to bite the tires on my truck. You know, it's just strange what you see with that. And so be cautious. And I'll tell you right now, I had a person who was bitten by his dog that died of rabies. And he did not want that dog tested because he loved the dog, and of course to test for rabies, you got to cut their head off. And he wouldn't let me do it. The day, it was a Friday that he contacted me, and I told him, look, rabies is a possibility here, and we need to get this dog's head in and get it tested. Oh no, he loved that dog. Well, he loved the dog. He's not vaccinated. Well, it bit him pretty badly, and it was dead the next morning, so then he decided, well, maybe he'll test it, and of course it was positive. You want to initiate rabies treatment fairly quickly because rabies will kill you. So dadgummit, get your dogs vaccinated. Do not. That disease is preventable, at least in your own pets. And that could have been fatal had we not been quick getting him seen by medical personnel. He could have died from that. So those are things that you got to really pay attention to. There's a lot of diseases out there that will kill you. And so be aware and pay attention. With pharmaceuticals, there's like the blacklegs. Like I told you, blackleg isn't going to kill you, but dadgum, it hurts. Most of our viral vaccines and stuff, they hurt. They're not really a life threatener. Some of our dewormers can be, because some of the dewormers that we use have a high rate of allergic reaction in people. And so you have to be aware of that. Some of the stuff we used to use, I don't know how many of you were ever around dipping vats or not, but the stuff you used in a dipping vat, that was nasty stuff. I'm sure that somewhere there's carcinogens associated with that garbage that we used to put in those dipping vats. It was terrible. But reactions were common. You used to get that skin on you and go to burning and turning red and itching. It was terrible. And then you know when the dog fell in there, he died. So there can't be great stuff for you. Drugs, little ice. I don't know how many of you synchronize or ever use utilize in your production systems, but lutelice is a potent bronchoconstrictor. And if you're asthmatic, you can have a fatal asthmatic attack, and this is rapidly absorbed through human skin. So the other thing is it has the same effect on women as it does on cattle. It lyses a CL. And so when I dispense this to somebody, if their wife came and picked it up, I always put it in a paper bag. I had it in a plastic bag and in a paper bag, and I would only let them carry the paper bag. They couldn't touch the syringe and stuff. You have to be careful of those things. But how do you know whether or not the stuff you're using is bad? It's on the label. If you read that package insert, there's a lot of information in those things. You ought to take the time and look at it and see what health hazards you have associated with the stuff that you're using. We talked about mycotil. Mycotil will kill you. So you got to know those things, and you got to pay attention. If you think about it, most pharmaceuticals are foreign to your body, which means it will result in some kind of an action. And how severe is that action? It depends on the drug. So be cautious of that. And allergic reactions can be severe from some of this stuff. It depends. I mean, an anaphylactic reaction kills you quickly. You die fast. But there are other different types of allergic reactions that are more delayed, like a type 2 hypersensitivity. It's going to be maybe 30 minutes or an hour down the road before you're in trouble. You need to know those kind of things associated with what it's at. There's chute side safety, pipes, bars, hand injuries, needle punctures. All of those things can happen. And most of this is preventable. It takes training and common sense. But supervisors at ranches, you need to go through this. Which side of the pipe do they stand on, for crying out loud? You got to tell them. You cannot assume that they know. That's what I've seen rupture 2 spleens. And these are people that knew. They knew better than to stand on the wrong side of the pipe. And we'll talk about that if we have one. And then, of course, there's animal-caused injuries. Do cows want to run over you? At times, yes. But for the most part, given a choice, would they run over you or get away from you? They would want to get away from you, right? They don't want to run through. Now, a lot of cattle want to run through you because they want to get somewhere else. And we have to keep that in mind, because sometimes we're standing in the way that they want to go, and it's not really their fault that we get hit. It's ours. So we got to pay attention to those things. And the other thing that I think that helps with this is good stockmanship training. If you understand what a cow is thinking and what she's trying to do, then you won't put yourself in a lot of positions where you get run over and banged up. And so we have to just pay attention. Food safety and wholesomeness, that involves record keeping. We talked about that in the BQA thing. If you treat something, you record it. We have to know those things. And how important a veterinary client-patient relationship is. You have to know and be trained on the things that you're using. If you don't understand a drug, ask your veterinarian, why am I given this? What is this for again? How do I use it? What are the concerns with it? Just ask. We're glad to share that information with you. And the other thing is don't use anything that's not approved. I know lots of instances, and in fact I found out the other day that at a show clinic for 4-H critters, they were telling them to use Baytril, which is the worst thing in the world, because Baytril is the drug that they have chosen to enforce the worst on, and it is prohibited for extra label use. It cannot be used in sheep. It cannot be used in goats. It is prohibited by law, and they're looking for somebody to hang because of that, to find that violation, because that is the class of drugs that was number one on their list. The enterofloxacins are the ones that they wanted agriculture to be the most judicious with. And if we have somebody out there saying, I use Baytril in a show lamb, we got to stop that. So you don't put something that's unapproved. Drugs, for instance, like Genocin, I don't know if you've ever used that, but Genocin creates an 18-month residue at the injection site. Exceed, I don't know how many of you use Exceed. We use it all the time. It's a great drug in cattle. If you put that in the muscle, they've shown now that there's 12 to 15 months of residue at the injection site. That's why it's labeled to be given at sub-Q at the base of the ear, because they know that, but they figure at the base of the ear, when you jerk the hide, it's gone anyway, it's not a problem. But we have equine practitioners out there telling cattle people to give that Exceed in the muscle of the neck. And now they just created a 12 to 15 month long residue. So we cannot do those kinds of things. So we need to be educated, and if it is we do not use something extra label unless we have, especially if we have an alternative, but if we use it extra label, we use it exactly as directed. We cannot, from a food safety standpoint, put drugs into our cattle that are prohibited. We can't do that. Most injuries and accidents are preventable by making sure your facilities are inspected and repaired. We all know that a great set of pins makes everything go better. But gosh, we accomplish a lot of things, and it used to be our mindset to accomplish things in the worst junk we ever saw. Oh, because we think we have to do it. We have to do this job. Well, no, sometimes we need to step back and say, no, I can't get that done today. We got to fix some things first. We need to make sure they're ready for it. We need to make sure that all those that we're in charge of supervising are educated about the safety concerns for their particular role and task. That means we might take a few seconds and say, hey, you know, if you go to an incident, which we were just at the last couple of days, we were doing an emergency exercise, the first thing before you assign a task is there's a safety briefing. Every single time. So they stop and tell you, hey, that briefing might be, look, don't go down this particular path because there's a place where there's loose shale rock and your horse may slip and fall. So if you get down, do this instead, or whatever it might be. If you're working around to shoot, you tell them this gate right here hangs up, and don't be in the wrong place when it opens. We were talking about last night. Sid was telling an example about a young boy. Wasn't it you that said that boy that was killed when they opened the hydraulic chute?
Oh, that was Craig.
Oh yeah, Craig. 19-year-old boy was standing in the wrong place when they popped the head gate open, hit him in the head and killed him.
He's down to pick up a discolored pad.
Those are things that you got to be aware of. And as employees, you should ask, anything I need to be aware of from a safety standpoint, especially if you're new, because you know what horses you're going to get in your string, right? The junk stuff, right? Well, you might ask, what do I need to know about this dun horse? Well, he pitches at the end of the day. That's kind of important information. You know, when you get back on after opening the gate, this son of a gun is trashy. Well, that's a good piece of news that you ought to know. Making sure everyone is aware of the health concerns of the products they're using. You gotta do that. If you're having somebody inject Lutalize, tell them what the hazards are so that they know ahead of time. And for crying out loud, I don't know why it's called common sense, because anymore you can't hardly find it. But common sense, we got to stop and think. And that's on both supervisor and employee. Stop and think a little. We need to make sure that we're not asking for trouble. Okay? So I wanted to plant that seed. We're going to go out and I'm going to show you a couple of things on a cow. And then let's get into some of these discussions. I do want to talk about that pipe. And where do you stand when you're using that thing, okay? So we'll migrate out to the